It's 4:30 p.m. here in Seoul. I'm Devin Whiting at the Arirang News Center, and it's time for today's briefing from the South Korean health authorities. We should be getting an update on the latest case numbers and trends in the data, as well as countermeasures being taken, of course, and possible clarification on the distancing rules, if those are to be updated. It looks like the briefing is about to begin. Let's listen in.
Today's briefing will be provided by Mr. Son Young-rae from the Central Disaster and Safety Countermeasures Headquarters. We will also be providing sign language translation. First, we will hear from Mr. Son Young-rae about the countermeasures against COVID-19. I will now start the regular briefing for Sunday, April 18th. As of midnight of today, there were 649 newly confirmed cases and there were 22 imported cases. Those in severe care are 102, and this is around 1.2% of those who are hospitalized. And for the hospital beds, we still have around 671 beds still available, and we still have 8,000 or 9,000 beds available for those who are severely ill as well. 3 people passed away yesterday. We pay our respect and condolences to the deceased and the family members. Yesterday, there were around 29,000 vaccinations that took place. And for the past several months, there were around 1,512,000 cases of vaccination. And now I'll update you on the past week. Over the past week, there were 621 newly confirmed cases on a daily average, and compared to around 590 or 80 from the previous week, it's actually an increase by around 7.3%. For the past week, the reinfection rate across the country was 1.1. It is similar to that of the previous week. The reinfection rate in the metropolitan area is 1.14. Reinfection rate is greater than 1, so this means that there is a higher risk of further spread of COVID-19. By regions, in the metropolitan area, there were 419 newly confirmed cases on a daily average and 202 for those who are in the non-metropolitan areas. Especially in the metropolitan area, we see a clear trend of the spread. And in the non-metropolitan areas as well, in Busan and in Gyeongnam areas, there were 80 cases that were occurring in a day. So this is showing that there is a heavy instance of spread. And many of the spread is coming from small gatherings and family members. Recently, we have seen cases from multi-use facilities such as sports facilities and entertainment bars as well. When we compare this to January and the massive outbreak then, we see that there is a surge. And for the multi-use facility, the use rate was around 16% at the beginning of January. However, it rose to 24% last week. We have seen a decrease in the cases coming from religious facilities. However, we see the numbers increasing in multi-use facilities such as sports facilities and entertainment bars. So we want to ask you to refrain from visiting multi-use facilities with a lot of people, and we want to ask you to practice frequent hygiene, such as washing your hands frequently and wearing face masks at all times. And especially when you are going to confined spaces, it is always important for you to go in small number of groups. Right now, there are no risks for the medical systems. We have done securing of the drugs, and we have seen that through advanced monitoring of patients, we are seeing a decrease in those who are severely ill. And when we compare the current situation to December 11th, that was the case when we had seen 678 newly confirmed cases in a day. However, there were around 129 people who were severely ill. However, today, we have similar number of newly confirmed cases. However, the number of severely ill are 103, so we are seeing a decrease in this number. Right now, we have more capacity in terms of our medical system. In the last year, we only have 52 available hospital beds for those who are critically ill. However, we have 611 beds available for those who are critically ill. This is a 10 times increase. And for hospital beds that are dedicated to those who are severely ill, we only had several in December, and we could only use several dozen. However, we are now operating 660, and we still have room for 611 more. And for those who are semi-critically ill, we still have room for around 230. Most of the death cases are consisting of those who are more than 70 years old. And we believe that with vaccination of the elderly, we will see a decrease in the number of critically ill, and we will be able to stabilize our medical system even more. There are advanced systems being strengthened for the vulnerable class so that we can decrease cluster outbreak. And for those who are working in public baths, we are monitoring them more closely, and we are making it mandatory for everyone to be tested on a regular basis. And we did the COVID-19 testing for everyone who is working there, and we have actually found cases in advance. And for the 8 local governments where these numbers were found, these testings will be taking place on a bi-weekly basis. And also, we are also going to strengthen monitoring for other facilities as well. For child care centers as well, we are making sure that all the staff members and teachers are being tested on a regular basis, and we are strengthening other measures. Of the 300,000 people working in child care centers, 180,000 people were tested, and we have found 20 positive cases of COVID-19. And the government will also make sure to quickly carry out vaccination for those who are working in these child care centers as well. And right now, vaccination is being carried out for these staff members, and we're going to actually start it in earnest starting it in June. And in preparation for the curbing of COVID-19 of those who are disabled, we are making sure that we are coming up with dedicated hospitals for vaccinations, and we are also providing facilities such as hospital beds. And we are also making sure that we are providing the emergency childcare and emergency wearing. And also for those disabled people who are more vulnerable to COVID-19, we are prioritizing them to be vaccinated first. The government will continue to monitor sites and facilities. And yesterday, the government has looked at many facilities such as PC cafes and restaurants and cafes, and site monitoring has been carried out for more than 17,000 sites. The police officers are also cooperating so that we can monitor entertainment facilities. And for those who are violating disease control rules, we are making sure that we are imposing strict fines. Right now, the risk of COVID-19 is growing, especially in the metropolitan area and in Busan and Gyeongnam area. So we need to make sure that the residents are especially careful. We ask you to cancel any gatherings or appointments if it is unnecessary. And please make sure that you're not staying at a single place for a long period of time. Please make sure to have gatherings only in small groups in open places if possible, and please make sure to keep social distancing. Until June, we are going to carry out vaccination for those working in the medical industry and the people who must be vaccinated. If we do so, we'll be able to see a decrease in the number of people who are critically ill. And we are also actively using the treatments. And we believe that starting in June, we will have more room for countermeasures. And it is important that we stabilize the situation until then, so that we don't see a massive expansion before then. And we ask all the residents and citizens to be especially careful. We hope that our citizens will be able to resume their normal lives as soon as possible, and we will make the best of our efforts. Thank you.
네, 지금부터 질의응답 시간을 가지겠습니다.
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at 6 p.m. Korea time. Bye for now.